Hey guys, in this quick video, we're going to be talking in depth about psychosis. First, let's get comfortable with the word psychosis. Say it, psychosis. Now say psychotic. That is the adjective form of psychosis.
Unpack your adjective.
The reason I'm getting you to say psychosis several times is because I'm trying to take the stigma and mystery out of the term psychosis. Remember, psychosis is a medical term, just like the terms influenza, the flu, hypertension, high blood pressure, or sinusitis, sinus infection. Now you might have several images and thoughts going through your head at this moment, all about the term psychosis. A lot of people get their knowledge about psychosis from how it's portrayed in media and entertainment. I'm here to say that some of these portrayals are fairly accurate, but a lot of them aren't. So now that you know that psychosis is a medical term, we'll start with the textbook definition of psychosis and some of the typical symptoms, and I'll show some examples. Psychosis refers to changes in the brain that interfere with a person's experiences of his or her world. Think of psychosis as like having a cold. What are the signs of a cold? Runny nose, sore throat, congestion, a slight fever, possibly?
Leonard, I'm sick!
Well, here are the signs and symptoms of psychosis. Hallucinations, hearing voices or seeing visions that others do not see or hear. The most common hallucinations are auditory hallucinations. For an example of an auditory hallucination, take a look at this clip from the TV show House. In this clip, this character is experiencing an auditory hallucination.
Hey, I'm talking to you. The cat's first. Now it's your turn, Lucy.
Shut up! Shut up! Shut up! It's okay. She just needs a little water, that's all.
Delusions. Delusions are false beliefs or marked irrational suspicions of others. Take a look at this clip from the movie Canvas. The character Mary has called the police because she believes there is someone outside of her window spying on her.
Did they check for footprints underneath the window?
Yes, they checked.
You are sure. No footprints.
Confused thinking. Confused thinking is disorganized thoughts or speech, including difficulty concentrating or understanding others. In this clip from the movie The Soloist, the character named Nathaniel is trying to engage in a conversation with Steve.
Whereas in Los Angeles, you have Los Angeles PD, you have LA Times, you have Los Angeles Lakers. Those are armies too. Military regimentation, experimentation, Roman Gabriel, Roman Catholicism, Colonel Sanders. But this guy right here is the quarterback of the orchestra.
As you can see, Nathaniel is having some challenges putting his thoughts to words. Steve only hears disjointed speech, but Nathaniel might actually believe he's talking coherently.
Yeah.
People who have any of these symptoms are identified as experiencing psychosis. In addition, they also commonly experience social withdrawal, disrupted sleep patterns, disrupted thoughts, memory, and attention, decreased motivation, pervasive anxiety, an inability to enjoy themselves, odd, unusual behaviors, including rapid changes in expectations, events, or routines, changes in appetite or eating, difficulty with daily activities such as school and/or work. What causes psychosis? Increasingly strong evidence suggests that schizophrenia and other psychosis-related illnesses are serious and complex disorders triggered by psychological and social stresses, but caused in large part by a host of biological events or disorders. This includes genetic mutations, fetal viral infection, birth complications, paternal age, infant or early childhood head injury, and/or autoimmune disorders. This evidence supports the view of psychosis-related illnesses as a real neurological and/or development disorder. Please keep in mind, however, that this information is relatively new and is subject to ongoing research. The symptoms of psychosis are treatable. Recovery from a first episode of psychosis is possible. Symptoms of psychosis should not be ignored because the longer they persist, the less chance there is for effective treatment and complete recovery. Early experience of psychosis can be extremely confusing and traumatic for both the individual and his or her family. Symptoms can cause them considerable distress and disruption. Psychosocial interventions can be very effective. These are aimed at reducing the stress and stimulation while teaching coping strategies for both the individual and the family. Treatment requires a comprehensive biological, psychological, and sociological approach, and a range of specialized treatments that address not only the specific symptoms, but also the impact of these symptoms on the individual and his or her family. If you are someone who experiences psychotic symptoms, I hope this video has given you some information that will better help you understand your symptoms. If you are someone who loves or knows someone with psychotic symptoms, I hope this gives you a better understanding about the reality of psychosis. While psychosis can be an unusual experience for everyone involved, it helps to know that psychosis is a medical condition that can be treated with medication, counseling, and social support. Thanks for watching.